TBI, what does it stand for? Traumatic brain injury. Is it just for those who are in the military or soldiers? Can it affect you? And what can be done about TBI if you've had traumatic brain injury? We're going to talk to an expert in the field of hormones and TRT who also deals with some men who have TBI issues, and after this, so keep watching. Hi, I'm Mike, the founder of Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, please consider subscribing and leaving comments so we can address them at the end of our videos. Today I'm here with Dr. Kathy O'Neill Smith. She is a prominent doctor in Boston in the United States. We're here in the United Kingdom where we're going to discuss this topic of TRT. First, we're going to talk a little bit about Dr. Smith's background. So thank you for coming.
Sure, I have a lot of experience with traumatic brain injury with 3 of my family members. That's number one. So my son had a traumatic brain injury in college where he was beaten in the head with a crowbar. And that was one that's on YouTube through AMMG because he had 5 intracranial bleeds at the age of 19. And so in different components of his head, big fracture, he was left for dead, brought into the hospital in California. We live in Boston, so I wasn't around, but I ended up there. And at any rate, what we did for my son Angus is to effectively make sure that he was sleeping well, had the best foods. We did a lot of IV nutritional therapy. We did some other IV small molecule therapy that allowed him to heal beautifully. Because in Boston, in Massachusetts, at Harvard, the Spalding Rehabilitation Center, their idea was to watch and wait. And of course, I'm the mother of a young man who was at the beginning of his life in college, a math major, who had to drop out of school, effectively, because of the injury. And there was no way I was settling for him not reaching his goals, his desired dreams. So basically treated him, and he, a year later, went back to school and graduated almost magna. So just like 0.1 away from that. So he did quite well. Yeah, and he's now 26 and working in the financial industry and doing quite well. I also have, I also work a lot with wounded warriors, and these wounded warriors are usually young. They're usually from Afghanistan, mostly, maybe a couple from Iraq, but mostly from Afghanistan. And generally they're under 35 years of age, but usually between 22 and 35 years of age. And they have a variety of injuries. Some are blast injuries, some are jumping out of a helicopter and their chute didn't open and they landed on their head from a very high distance, and there's all different kinds of injuries they have. But I think most people have some form of a brain injury. Who hasn't hit their head on a car door or a bed or some other injury from childhood? We've all had an injury, I'm sure. And the reality is how is that affecting you and what is that disrupted? So many people have had car accidents. I have a lot of patients who have had car accidents and they didn't even realize they had a TBI. They were put on so many meds. They were self-medicating with marijuana and alcohol. And once we fixed their brain injury, they stopped medicating. No more alcohol, no more marijuana, optimized weight, etc. So, I mean, I think that it's bigger than we realize as a problem. And if we can really address this and optimize the neuronal circuits, then we're going to be in luck.
So I was just going to ask, it's more than, you don't necessarily have to have a concussion to suffer from traumatic brain injury.
No, one of my daughters, and she was playing hockey, ice hockey in Boston, and she was going so slowly on the ice. It was during high school, young years, and she and another woman collided so slowly. The other woman was in the hospital with a concussion for 10 days. My daughter was home. I'm sure she had a concussion as well, but she didn't experience the symptoms of it at the time, right? But these can have long-lasting effects. They can often be not necessarily acute, and they show up a little bit later, just like a CTE, chronic traumatic encephalopathy, in a football player. Because a football player, bangs their head a million. I'm a big fan of American football. although
Yeah.
I can't believe it because these men, and I work with a lot of the
Yeah.
NFL, National Football League players, and effectively they don't know until it's over that they're not doing well from this chronic, not acute, traumatic from trauma, brain that's not functioning well, encephalopathy, CTE. And there's the movie on that, right?
So even football with heading the ball, or soccer.
Yeah, soccer.
Yeah.
Same.
You'd have that, or boxers.
Right.
If you're
Boxing, forget about it.
Okay, that'd be.
You're guaranteed.
But how would you know, besides remembering the event, you start having some functional disability down the road, something that isn't quite right? I mean, what are some of the signs that you should be aware of?
Some of the signs are emotional, imbalance. So it could be anxiety, it could be depression, because they're on a spectrum, right? So it's really just mood instability. The second thing could be focus and concentration, right? You know that you're different. The third thing can be disrupted sleep. It's either too much sleep or too little sleep. Disrupted sleep doesn't mean it's one or the other, right? Some people have too much and they can't wake up. They're never rested. And some people can have too little sleep. So really kind of the symptoms that go along with the brain, certainly low testosterone or low T can result from brain injury because the brain directs growth hormone, testosterone, thyroid hormone, many of these different hormones. You also have to remember, and when I teach at conferences in the United States, A4M, you name it, we talk about when there's a leak in the brain from an injury, leaky blood-brain barrier. There'll also be a leak in the gut. So leaky blood-brain barrier is effectively an increased permeability in the GI tract, which can be also called leaky gut syndrome. So because I think of it, I always come up with a logical way to think of it, and I think, okay, well, the body knows that if you have a brain injury, it's going to need more nutrients. So it's going to try to open up to allow nutrients to come in more readily to heal you. Proteins, good fats, omega-3s, DHA, and all of those things. That's just my story around it. But, that's a way to understand it. Of course, if you've got an injury to your brain, you need better nourishment. And so the gut will have an injury as well, always.
If you're already doing the right things with your diet and your supplements, you can still get a traumatic brain injury. Are you going to have a better outcome?
Yes.
Because you have, so it kind of goes back to the point, if you lead a healthy lifestyle,
absolutely,
you should have a better outcome for recovery.
Always. It's true with COVID.
Yeah, it's with everything.
It's true with everything. I mean,
true.
that is why I do what I do, because if we can help people even make one change can lead to another change, but that little change can make such a big difference.
So what are the tools you have at your disposal as a doctor that kind of practices? And first of all, you've got to recognize that someone has this, because couldn't some of these symptoms you described, could it be sleep apnea? Could it be low T or another hormonal disbalance, thyroid issue?
Of course.
How do you determine that from true traumatic brain injury? I guess the history might tell, but they might not remember because it would have been so far in the past. So what do you do in that regard? And then what are your tools for actually helping fix the problem?
Yeah, I think that obviously the wounded warriors know that they've had brain injury, and they know the nature of it because somebody observed it in their troop, right, in their team. In life, it doesn't really matter anymore because we're going to find the effects of it. So if you have low T or neurotransmitters that are imbalanced, we're going to find the effects of it. Is there an immune system dysregulation? Do you have an inflammatory setup in the brain? Are there microbes now that have entered the body, and are you just, do you have too many antibodies to one type of a microbe, and now your immune system is polarized and not adequate? You don't have an adequate Department of Defense. So is your mitochondria functioning well? Do you have too much oxidative stress, like rusting and, kind of not a good... So you have to measure, because you will have more than one. Just because you don't have a symptom doesn't mean you're well. When you measure, you can then say, hey, do you maybe feel this? And you can understand the nuances of a symptom. Fatigue can be mental fatigue, can be physical fatigue, can be one more than the other, can be both equally. So you learn to ask questions based upon the numbers that you see and the story that the patient has. And then subsequently, you treat based upon what's showing up and the story. You put them together in the lab data. So, and then you never try to win it in the first period of the game. You have to win it successively over time as you restore, right? It's like building a castle,
Okay.
you know, so you have to win it. And I always think I want to win it by the end of the fourth quarter. So, you know, I'm doing trial and error, not hit or miss, based on lab data. It's trial and error. But how are we going to get the patient to feel better? And in my practice, within 24 hours, I expect you to feel something better if I give you a treatment.
And what would the different treatments potentially be for?
Again, I'll usually start, if someone has a brain injury, like my wounded warriors, they all get an IV treatment. And I see if I can help them to feel better. Are they less tired? Are they better focused? What is it? So I'll do an IV nutritional therapy like treatment, nothing out of the ordinary, and see, based on their symptoms, how they're feeling. We'll definitely, if their labs indicate, do testosterone trial therapy by injecting testosterone. We'll try upregulating the mitochondria, maybe with D-ribose or alpha-ketoglutarate or glutathione, because a lot of these people have a deficiency in detoxification. And if you don't have adequate antioxidants, your oxidative stress, you'll be like a swamp instead of a free-flowing river, right?
Now, about antioxidants, I know that was a big thing in the 90s, late 90s, early noughties, but then there have been some papers that have said, oh, well, what about the body's own antioxidant system? Are you suppressing that by taking exogenous antioxidants? Or what is your experience on?
I measure, again, you can measure glutathione. So if you can measure glutathione, if you can measure the amino acids that make up glutathione, and then you know the cofactors. I mean, what I've been taught and what I've listened to and what I read extensively isn't always consistent with what I'm seeing.
Yeah.
And so I have 15 years of data, right?
From your own practice.
From my own practice.
Compared to some observational study that's making weak correlations.
Correct. So I have 15 years of data that pretty much is consistent for what I understand about physiology, and I am a physiologist, right? So I understand biochemistry and physiology. So I have the data.
George, by the way, he's been on the channel a few times. He's a pathobiophysicist.
Right. So I've been a pathologist, I've been a physiologist, I've been an internist. So putting all of these hats together helps me to understand and then measuring at the same time. And I would say that what I find in the measurements is relatively consistent between patients. But what we do in conventional medicine, sadly, is wait to use a medication, but we're way beyond the point of easy return. And for me, it's not what I do. I will not waste an opportunity. I feel like that's a missed opportunity to help someone be well. So the brain injury patients, I have lots of these young men, and you know, we treat them with a combination of hormone support, hormone replacement, I think of it as support, with nutritional therapies, with lifestyle therapies of sleep, and et cetera. And then small molecule therapies, which we can have some access to. And I also use other modalities like red light.
Okay.
I use photodynamic therapy or light therapy, so red light.
But putting red light on your scrotum will give you more testosterone.
No, it definitely will not, no. I use PEMF or something more advanced, which is called electromagnetic transduction therapy. So I use a variety of other mechanisms and modalities as well that are well studied.
What about the neurosteroids? I've heard of pregnenolone, DHEA, the allopregnanolone.
Love them. So those are some of the basics, and you can measure some of these.
Okay.
So anything I can measure, and anything that's natural to your body, I don't even think of as a treatment. I think of it as a support.
So what about use of like clomiphene to kind of boost the LH and the pituitary? Does that have a role in it as well? Or?
Totally, absolutely. I like a new product that's called Testo. It's an intranasal, and it's a gel, and basically you spray inside each gel for young people, and you squeeze it, hold it there, and it gets absorbed, and you take it multiple times a day. That's the only problem with it. In order to bring your levels up, they come down, and people like that.
Like you said, as long as you catch, before it goes too low with symptoms, that's okay. Because everyone, and this is kind of kind of a sideline, is people are so worried about, I've got to be stable and flat. And my opinion is, what they mean by stable and flat is in your mood and feeling okay.
Correct.
You're still going to go up and down, even your natural hormones. But
Always.
if you go down too low, below a certain threshold, that's when you don't feel good.
That's
so don't
correct.
fixate on these numbers.
No, don't.
Yeah, okay. So,
No, it's a range, right? Everything's in a range. Blood sugar, ideal range might be 84 to 100, right?
Yeah.
So, and that's a big range, actually. But everything you want to be in a range. And the range that one person feels good in is not going to be the same that another person feels good in.
Yeah.
And we don't want to do a public health therapy for you. We want you to be well. We don't want you to think that you're like anybody else, because you're not. You don't look like other people. You look like yourself. You know?
So I guess to kind of summarize this, every person who has this traumatic brain injury, and it's probably similar with other treatments that you offer, like TRT and HRT, needs more of a bespoke, customized for the individual based on the proper blood testing to kind of monitor how you're going, as well as checking with the symptoms.
Always, yes.
Okay.
Always. And really, it's physiology. So the diagnosis isn't the important thing, that it was TBI. The result and understanding what the result of the TBI years before that you're seeing something, regardless of whether you can connect it to an event, isn't the important point. The question is, can you understand the physiology and correct it? We always want to take aberrant physiology and optimize it to the best of our ability. Why would we not? We would do that for our car.
And that's clearly the theme of your clinic, treating wellness.
Correct.
Which I love it. That's really what we're trying to do here in the UK is treating wellness. And obviously there's some obstacles. We were talking about the regulatory situation here, but we're doing our best to improve the lives of men and women. And there's, I think that's something that we should focus on rather than the sick care. And that is the healthcare, especially government-run healthcare.
You will have no control if you leave it up to the government.
Yeah.
You will have lots of control if you connect with any clinic that really cares about you.
Yeah, that's kind of what our mission is. We're trying to, like I said, push through any of the roadblocks that are there. So, any last words on this before we answer a question from one of our? No. Okay. So, as promised, for continuing to watch through the whole video, we're now going to discuss one of the comments from one of our viewers, Tim. He said, "Hi, I've been on testosterone for about 8 months. Really no change. Still tired. No sex drive. Bit disappointed. I'm on fluoxetine and wonder if this is cancelling out the effects of the T. He's going to have another blood test soon, and has been lots of talk about changing from injections to creams. Any thoughts on this? I think we touched on the modality before, and we were talking about like fluoxetine. How it was interesting what you were saying. It may affect things in the synapse. So,
Yeah. So fluoxetine is going to work in the neuron synapses, right? So you've got 2 neurons with the synapse. When you use fluoxetine, you're essentially going to make your serotonin work much harder. And when you make something work harder, it gets tired. So instead of allowing for reuptake and creating new molecules, you're trying to use one molecule for a very long time. So it sounds to me like, someone like this, in addition to testosterone, again, you've treated one thing and you've uncovered that there's an additional problem. So you would need to think about the adrenal gland, of which cortisol is one part, DHEA, which you can measure, is another part, because DHEA is essential for your anabolic steroids. But then the other part is neurochemicals. So dopamine is very important, noradrenaline is a very important neurochemical. And I think for someone who is having TRT, on TRT, and not feeling the full benefits of it, you have to find out what the next step would be. Again, as we discussed earlier, it's a phased program for optimizing everything. But now I would say it's likely that amino acids are important, and that there may be a gut issue, and a gut issue with digestion possibly, maybe absorption, then maybe assimilation. So if you're going to make your neurochemicals that are going to give you, if you imagine dopamine, it's like, hey, I feel great, I can do this. People who have high dopamine levels really want to have sex a lot. Yeah. So the reality is high dopamine levels are quite important. So I think that understanding whether the amino acids are being assimilated is important, but then maybe trying something dopamine-like. And when you're on fluvoxamine, you're tipping the balance of serotonin and dopamine, and that may be a component of it.
So you think it's something like selegiline?
Right, selegilin's,
There's another name for that.
Well, you can also try mucuna, right? Mucuna is also dopaminergic, right? So you can try...
Tonkat Ali as well?
You can try Tonkat Ali, you can try ashwagandha, rhodiola, you may need holy basil or something like that.
I know it's better to do more non-pharmaceutical interventions,
Right.
but we besides the selegiline, any other types of, was it dopamine agonists would you recommend? Or?
You know what else I like is oxytocin.
Okay.
I love oxytocin. So I use some oxytocin in some of my wounded warriors, and they relate to the world better. Things feel better.
Is it, how do you take oxytocin?
You can take it either
Cream?
sublingual,
Sublingual,
like
okay.
as a troche. You can take it as a cream. Yeah, so you can
Okay.
do oxytocin, pretty safe, exceptionally safe. But I might try a selegiline at a low dose first
Okay.
to get the effect, like a trial of therapy. And then if that works, then you know what you're trying to feel when you're using the other dopamine
And
agonist.
do you recommend the patient staying on the fluoxetine, or are they trying to wean off of it because you said they can have some?
I would try to wean off over time.
Okay.
I mean, I think that fluvoxamine has its role for sure. And certainly if there's an inflammatory component, an immune system dysregulation in the central nervous system, with COVID we've seen the benefit. But
Yeah.
I think that there's got to be something going on at a more root
Yeah,
cause
he
level.
said in the earlier post that he's 63, but also has Hashimoto's as well.
Well,
And may have
Hashimoto's is
various
also
food
a gut
intolerances,
problem.
So, and an autoimmune problem too, yeah?
Autoimmune generally stems from the gut. You've got to
Yeah.
fix the gut first. You've got to you've got to heal and seal the gut,
Okay.
right? So you want to basically take away things that are disturbing the gut, like foods that you're intolerant to, and then seal the gut with marshmallow root, and glutamine, high-dose glutamine
Okay.
powder, and marshmallow root, and there's a variety of things. Usually in the States we have products that are together that are fantastic. It's one of the #1 things that help people. It's called GI Revive, Revive the Gut.
Okay.
GI
Well, that's-
Reset, GI Restore. Every company has something
One
like
of
that.
our doctors focuses on functional medicine, so we'll be able to
Measure.
measure and help this patient through that. So, wonderful! Thank you for
You're so welcome.
answering the questions and being here with the Balance My Hormones. For everyone else watching, please leave your comments for next time. We'll address them, and consider subscribing. And we'll see you next time. Thanks again.
Such pleasure.
Yeah.
Good to be
You
here.
too.
Thanks, Mike.
Thank you.